Hello, my name is Tiffany. Today is January 23rd, and it is almost 8 o'clock. I am here to do my head to toe assessment. I shut my door for privacy while I wash my hands. Hello, my name is Tiffany, and I'll be your nurse. Can I have your name and date of birth? Tasha Bear, 9/19/51. Perfect, thank you. I see you were admitted for the flu. Are you having any concerns? Are you feeling okay today? Yeah? Okay, perfect. Patient verbalized that there are no concerns and she's feeling much better. So, what I am going to do is a full head to toe assessment. Before we begin, could you please tell me where you are? Thank you. The year and the precedent. Patient is alert and oriented times three and doesn't have any slurred speech. So what I am going to do is start at the top and kind of work our way down to make sure everything looks good. Just wash my hands again. Assess the scalp, make sure there's no lesions, bumps, bruises, nothing of concern. Check out the ears. They're patent, no drainage is present. Okay. Face is symmetric. Right. Next, I will check for Perla. Usually I would turn the light off to get a good visual for her pupil, but for video purposes, I will just keep the lights on. So Mrs. Bear, I'll just have you look straight ahead for me. Just want to shine a light and look at your pupils. Perfect. Pupils are equal, round, and reactive to light. 2 millimeter pupil size. And next we'll check for accommodation. So Mrs. Bear, with your eyes, you'll just kind of follow my pen, okay? Okay. An accommodation is present. Check nasal passages, make sure they're nice and patent. I'll check inside her mouth. Pink, moist membranes. There are no lesions or cracks present. Teeth are in place. Okay, perfect. Next thing I'll do is feel her carotid pulse. +2 and strong on each side. Next, I'll check for skin turgor, make sure there's no dehydration. No skin tanning is present, so no signs of dehydration. Check out her skin, there's no wounds, abrasion, skin is warm, pink, feels great. The next thing I will do is I am going to check some vital signs. I would take her temperature, 98.6, put a pulse oximeter on her, get a heart rate of 67, oxygen 98 on room air, listen, follow her respiration, 16. There is no nasal flaring, there's no accessory muscle use. Check tap refill, listen 2, feel for the radial pulse. Okay, wonderful. And then what I will do next is, while I'm right here, actually, I'm just gonna have her kind of squeeze my fingers for grip. And then while, again, we're at this spot, I'll check range of motion. So I would have arms to the side, arms in front, range of motion is present. I would then want to move to listening to her anterior breath sounds. For the purpose of the video, I'll go over her gown. In clinical setting, I would want to go stethoscope to skin just so I wouldn't pick up any additional sounds. All lung sounds were clear, no adventitious breath sounds. Bronchovascular breath sounds heard in this region right here, and all throughout other lung bases, vesicular breath sounds were heard. The next thing I would want to do is listen to her apical pulse, left midclavicular line, fifth intercostal space for 1 minute. So I would pretend that I would do that, make sure that I hear clear systole and diastolic sound. Make sure there were no murmurs, no S3, S4 heart sounds. What I would want to do next is we can move down to abdomen, belly region. So first, again, ensure privacy, inspect abdomen, stomach. There is no abnormalities noted. I would then want to listen to all four quadrants, starting in her right lower quadrant for bell sounds. Bell sounds present in all four quadrants. The next thing I would do is palpate, make sure there's no tenderness or pain. Please let me know if there's any tenderness or pain. Okay, there are no abnormalities felt, no voice of pain or tenderness. Again, looking at her skin as a whole, there are no wounds, no concerns. Again, skin is warm, pink. All right, so what I would want to do now is move down to her lower extremities. Blanket. Next, I would assess the lower legs. Pink color, there is no wounds. Check for edema. If there is no edema present, I would check on both lower extremities. Next, I would feel for her dorsalis pedis pulse. +2 and strong, +2 and strong, and then her popliteal pulse on the side of her foot. +2 and strong bilaterally. I then check her cap refill of her toes. Cap refill less than 2. Check the bottom of her feet. Make sure there's no wound or ulceration noted. I then would want to check range of motion of her lower extremities. So we would bend the leg, extend it out, make sure there's no pain or concerns with that on each side. The next thing we could do is check like dorsiflexion and plantar flexion, make sure we are doing okay there. I would also want to ask my patient about her most recent bowel movement, make sure it was normal for her. I would also want to check urinary pattern, make sure there's no concerns there, that she's not having any burning or difficulties with urination. Patient has been cooperative during the head to toe assessment. If she had any IVs or medications hung up, I would check that, check her IV site, make sure there wasn't anything of concern. If there are any wounds, I would want to address that. For discharge for a patient recovering from the flu, I would just want to make them be aware to continue resting really well, hydrating, eating small, frequent meals throughout the day, like lean proteins, fruits, vegetables. Again, staying really hydrated. I would also want to make the patient aware that if they had any new onset or worsening of symptoms, like any shortness of breath that started to get worse, chest pain, a high fever, especially that wasn't coming down with any antipyretics, to present back to the emergency room, just so we wouldn't get dehydrated again and start to deteriorate. Um, Overall, my patient doesn't have any questions. Was very cooperative, alert and oriented, and that's it. Thank you.